Have you ever stopped to think about how all the different computer systems in a hospital actually talk to each other? I mean, from the second you check in to the moment your doctor gets your lab results, there's this constant and visible conversation going on. So let's dive in and uncover the secret language that really makes modern healthcare tick.
But what happens when that conversation breaks down? When one system sends a vital piece of information and the other one just doesn't get it? The consequences? Well, they can be really serious. We're talking about everything from treatment delays to major patient safety issues.
And this isn't just some hypothetical. It really happens. Take the story of MedAllies Health. Their doctors were staring at screens that just said pending for critical lab results. But the lab was adamant. They swore the results were sent. So where was the data? It had just vanished, stuck somewhere in the digital space between two systems. And that's the exact problem we're here to unpack today.
So what's actually causing this kind of chaos? Well, it all boils down to a fundamental problem, a digital disconnect.
Here's an easy way to think about it. Imagine I try to have a conversation with you, but I only speak English and you only speak, say, Japanese. We can both talk all day long, but we won't understand a single word. It's the exact same problem with healthcare systems. If they don't have a shared language, one system sends over crucial patient data and the other just gets an unreadable jumble of code, an error.
So clearly that's not going to work. What we need is a solution, right? Some kind of universal translator that all these different programs can use. We need a common language for healthcare.
And that language actually exists. It's called Health Level 7, or as pretty much everyone calls it, HL7. Just think of HL7 as the official rule book, the grammar and vocabulary that allows all these different healthcare apps to actually understand each other. When both systems are speaking HL7, the information just flows back and forth, no problem.
And just to be clear, this isn't some minor niche technology. This quote from HL7.org, the folks who manage the standard, says it all. HL7 version 2 is pretty much the bedrock of healthcare communication across the entire globe. It's the invisible engine that's quietly running in the background of almost every hospital you can think of.
Okay, so now that we know the language they're speaking, let's meet the main speakers in this digital conversation. These are the key systems that are constantly chatting to coordinate all of our care.
First up, we have the electronic health record, the EHR. This is Command Central. It's the main screen your doctor and nurse is looking at, the one that holds your entire patient history. This is where they go to order a lab test or an X-ray, and it's exactly where they expect to see the final results pop up.
So when that order for an X-ray gets placed, it's usually sent over to a Radiology Information System, or RIS. Think of the RIS as the air traffic controller for the radiology department. It's managing all the logistics, scheduling the patient, telling the techs who's up next, and handling the final reports. It's all about workflow.
But where do the actual pictures live? The X-ray images, the CT scans. Well, that's the job of the PACS, the Picture Archiving and Communication System. It's basically a massive, super secure digital filing cabinet built just for medical images. It's what allows a radiologist to instantly pull up your scan and make a diagnosis.
Now, it's really easy to get RIS and PACS confused, but they do totally different jobs. The RIS is all about the information and the administrative tasks, schedules, reports, the text-based stuff. It's for the staff and the technologists. The PACS, on the other hand, is all about the pictures. It's for the radiologists and surgeons who need to see the visual data. And for anything to work, you better believe these two systems have to communicate perfectly.
Okay, so we've got the language, and we've met the speakers. So now, let's actually trace the data from start to finish to see how this all works in the real world.
So let's follow a typical journey. The second a patient gets registered, an ADT message gets blasted out to all the other systems. It's like a little digital announcement saying, hey, we've got a new patient. Then, a doctor orders a CT scan in the EHR. That triggers an ORM, or order message, that shoots over to the RIS to get it scheduled. And finally, once the radiologist writes the report, an ORU, a results message, sends that report right back to the EHR for the doctor to see. It's a beautiful three-step dance, and every step is an HL7 message.
And you've got to remember, this is happening constantly, for every patient, every single order, every result. It's this incredibly complex digital symphony, all coordinated by HL7, making sure every piece of information gets exactly where it needs to go, right when it needs to be there.
Okay, so that's a lot of complex stuff happening behind the scenes. But why does it matter so much? I mean, what's the real-world payoff for getting all of this right?
This one number really says it all, 95%.
According to HL7.org, a staggering 95% of healthcare organizations in the US use the HL7 standard. That kind of adoption is just massive, and it's because the impact is absolutely critical.
So this is the payoff. When all your systems speak the same language, you're ensuring patient safety because you're not mixing up information. You're maintaining data integrity, so results always match the right patient. You get super efficient workflows, which means less waiting for everybody. And ultimately, you're slashing the kinds of delays and errors that can directly impact a patient's health.
So let's bring it all the way back to where we started. Remember that problem at MedAllies Health with the lab results that went missing? This is the solution. A properly set up system using a shared language like HL7 is what prevents that data from ever getting lost in the first place. It makes sure that crucial information flows from the lab to the EHR to the doctor reliably every single time.
You know, healthcare tech is always moving forward. With these powerful new tools like AI and cloud computing becoming the norm, the demands on this invisible language are only going to get bigger. It really leaves us with a fascinating question to chew on. What is the next generation of healthcare's common language even going to look like?